Thank you. Comrades, power.
Power.
Public health, hoye.
Hoye.
Health workers, hoye.
Hoye.
Thank you so much, Honorable Chair of the caucus, Mr. Peterson Washira. My name is Brown Ashira. I'm the General Secretary for the Public Health Union. I'll go straight and read the statement. That is a joint statement between the Health Union caucus on the absorption of UHC and Global Fund staff to permanent and pensionable terms. We, the Health Union caucus, comprising of Clinical Officers Union, the Kenyan Environmental Health and Public Health Practitioners Union, the Kenya National Union of Nurses and Midwives, Kenya National Union of Medical Laboratory Officers, the Kenya National Union of Nutritionists and Dietitians, the Kenya National Union of Pharmaceutical Technologists, and the Kenya Medical Practitioners, Pharmacists and Dentists Union convened an urgent meeting to address the continued injustices facing the healthcare workers, particularly the Universal Health Coverage, UHC, and Global Fund staff who have not yet been absorbed into permanent and pensionable status. With only 2 weeks remaining before the expiry of their UHC contracts, healthcare workers are experiencing heightened anxiety and frustrations, having waited for the issuance of PNP appointment letters, which to date have not been released. This uncertainty has caused immense distress among the affected workers and their families. We note that in the 2026-2027 budget estimates approved by the Parliament, cash to 8.9 billion has been allocated under conditional grants for the payment of salaries for UHC staff for 1 year. While this allocation is appreciated, it does not provide sustainable solution to the long-standing issues of employment insecurity facing the UHC and Global Fund workers. In light of the foregoing, therefore, Health Union caucus demands the following. 1. Immediate absorption of all the UHC and Global Fund staff into permanent and pensionable terms and issuance of appointment letters by 30th of June 2026. Number 2, Parliament to include the allocated funds through equitable share frameworks rather than annual conditional grants, which are unsustainable and continue to expose UHC and Global Fund workers to uncertainty and job insecurities. And then number 3, the Health Union caucus to be actively involved in engagements regarding the transition process of the UHC and Global Fund workers into PNP terms. Failure to address the foregoing demands above, all the unions represented in this caucus shall, number 1, proceed to industrial action without further delay to demand for full transition into permanent and pensionable terms for all the UHC members as agreed by 1st of July 2026. Then number 2 is that we shall mobilize all the members to to demonstrate and pitch camp at the National Assembly and the Senate until the required resources have been allocated as equitable share under the DORA. DORA is Division of Revenue Act. In conclusion, we urge the National Assembly, the Senate, the National Treasury, the Cabinet Secretary for Health, and the Council of Governors, that is COG, to urgently consider these demands and work collaboratively towards providing a lasting solution to the plight of UHC and Global Fund workers. Further, we urge His Excellency the President, Dr. William Samoei Ruto, to intervene and ensure that the jobs of UHC and Global Fund workers are secure to ensure achievement of a WENE plan and by extension universal health coverage. Lastly, the Health Union caucus remains committed and open to constructive dialogue and engagement with all relevant stakeholders to ensure successful absorption of UHC and Global Fund workers and strengthening of the Kenyans' healthcare system for the benefits of all citizens. Comrades, power.
Power.
That is the statement.